The National Health Service has been called the closest thing the British have to a religion. Ever since its creation in 1948, it's held a special place in the national psyche. And right from the beginning, its workforce has been drawn from all over the world. The one thing most non-Brits know about the NHS is that it's free. So if you visit the doctor, it's free. If you need an operation, it's free. Having a baby is free. Parking at the hospital is... Actually, they charge you for parking at the hospital. But if you get hit by a car and need to go to hospital by ambulance, it's free. While the NHS may be free to use, it's not actually free. Next year's health budget will be something like £140 billion. The total cost works out to about £2,000 per year per person, which sounds a lot, but it's actually quite low by international standards. In the US, for example, per capita healthcare spending is more than double that. The NHS may be one of the most efficient health services in the world, but it's also a sprawling entity. UK-wide, there is a baffling array of NHS bodies. Over 500 clinical commissioning groups, health boards and hospital trusts, about 8,000 GP surgeries, plus the voluntary sector, private providers, and others. It also has numerous separate bodies for regulation, training, and strategy. Ooh, where was I? If that sounds like a system sorely in need of reform, that is the reformed version. The product of a 2012 Act of Parliament designed to give much more power to doctors in deciding how the money gets spent. In fact, the whole history of the NHS is a series of compromises between politicians and doctors. When the Labour government first created the NHS in 1948, it was in the face of bitter opposition from the doctors' trade union, the British Medical Association. One leading member of the BMA at the time said the NHS was the first step, and a big one, towards national socialism, and called the health minister, Aneurin Bevan, a medical furor. Move forward to the present day, doctors are barely more polite about their political paymasters. The current health secretary, Jeremy Hunt, has found that his name has become, unfortunately for him, rhyming slang for
to give them a 1% rise.
But if NHS history has been politically turbulent, it has also been packed with clinical advances. In 1958, polio and diphtheria vaccinations were rolled out nationally, drastically reducing deaths from these illnesses. In the 1960s, the contraceptive pill was given first to married women, then all women who wanted it. 1978 saw the world's first test tube baby being born. 1979, the first UK heart transplant. The 1980s saw pioneering use of keyhole surgery, and in 2002, the first gene therapy. But with glorious successes, there have also been terrible failures. In 2013, a report into appalling patient neglect at Stafford Hospital identified hundreds of vulnerable people who suffered at the hands of staff and called for a culture change in the NHS. Patients, the report said, were let down by a system that put cost-cutting and target chasing ahead of the quality of care. Winter brings the service's biggest challenges. Seasonal colds and flus can endanger the already sick. Staffing is stretched, and most non-hospital services close for the holidays. Hospital bed shortages are commonplace in winter. Despite these challenges, the NHS mostly works, and its founding principle remains a point of pride. Universal healthcare, free at the point of use.